Hello, my name is Jennifer Lotito. I'm the president and COO of RED. Welcome back to another episode of RED Talks, generously sponsored by ViiV Healthcare. We live in a world where AIDS is still a crisis, and preventable and treatable disease are only preventable and treatable for some. Marginalized communities, including young women and adolescent girls, bear the brunt of this injustice. To end it, we must increase prevention programs and other interventions that help empower girls and young women to be in control of their own health and well-being. Here to talk more about this, we have an amazing group gathered today, including Cathy Ferrier, the head of Positive Action at ViiV Healthcare, Rukia Männikkö, Community Rights and Gender Regional Advisor and Focal Point for Africa and Middle East, the Global Fund, Yacine Djibo, Executive Director of Speak Up Africa, and Millicent Sethaile, a Her Voice Ambassador in Botswana. Thank you all so much for being here. Rukia, I want to start with you first. So HIV disproportionately affects marginalized groups, and we know that women and girls are often among the hardest hit. In sub-Saharan Africa, HIV prevalence is over 3 times higher amongst girls and young women than among boys and young men. Where are we in the AIDS crisis today, and how and why are women and girls hit the hardest by this crisis?
First of all, I want to start by thanking RED and ViiV teams for organizing this important discussion today and for inviting me and the Global Fund to join you and other amazing speakers today. I'd like to group the challenges facing women and girls under 3 categories and why they actually face these issues. First of all, from a socio-cultural perspective, if we look at the power dynamics within societies, whether it's at the social level, at the community level, political level, economic level, and unfortunately, women and girls in these societies within sub-Saharan Africa and many parts of the world are still struggling for equal opportunities in accessing their rights, in enjoying these rights. If we see that compared to the position that actually men and boys occupy across these countries. And we are still seeing practices that are harmful. We are seeing retrogressive cultures that are negatively impacted on the situation of women and girls. We are seeing development being impacted negatively just because of these social and cultural conditions. And of course, this increases risks to infection. This affects access to services, access to information by women and girls. And the other category I'd like to discuss is from a political and legal framework perspective. And some of the challenges that are facing women and girls includes limited or lack of proper laws and policies against various forms of violence, including sexual violence. This also means reduced or very limited conviction of perpetrators who commit these forms of violence. And of course, this certainly affects the funding scenario and investments in these programs, because where we do not have policies and policy frameworks that actually support the safeguarding of these rights, we have seen it has also impacted on funding, whether domestic funding or external funding. And we also know in various countries, we still need to do a lot of work in terms of having enabling policies and laws that improve access to services by women and girls, especially adolescents, when it comes to age of consent to access services, age of consent to access services, including reproductive health services. So these are some of the challenges. Thank you, Jen.
Thank you so much, Rukia, for giving us that overview, and thank you for all of the work the Global Fund is doing to address all of those significant issues. I want to next turn over to Cathy. Before I ask a question, though, Cathy, I want to start by thanking you and thanking ViiV Healthcare for being such incredible supporters of RED and helping to bring this very important conversation series to life. It's so wonderful to see companies like ViiV stepping up to end AIDS and serving as a real model for other companies to join the fight. We're thrilled to be working with you, and we're thrilled to see the work that ViiV is doing in this space. Can you tell us a little bit about ViiV Healthcare's efforts to tackle HIV and AIDS, especially in priority populations such as adolescent girls and young women?
Thanks, Jen. Yeah, it's a pleasure to be here, and a delight to work with you guys. But we all need to be together in this fight, as we know. So we are absolutely keen to partner with as many people as possible, because we have to do this together. In terms of positive action and ViiV Healthcare, we have been funding programs to support adolescent girls and young women for many, many years. Positive Action's now been going for 30 years, more than 30 years. And what we're trying to do is to make sure that we put resources in the hands of those young women and girls who need those resources. And we do that by working with community-led organizations through lots of different types of programs. So whether it be funding a program supporting adolescent girls, adolescent mothers living with HIV and their children, or whether it's a program where we're trying to empower young women to take their place in decision-making spaces. We do a wide range of programs that we fund to support women and girls. The Her Voice program that we've been running for funding for many, many years with the Global Fund really works to empower young women to take their place at those decision-making places, so that they can have their voice heard, and we can elevate their voice and make sure that they can actually access the services that they need and that meet their needs. And we do that predominantly in 13 key priority countries where the highest burden of HIV is, in sub-Saharan Africa. We've been working alongside many partners who are really, really strong implementers in this space. And I think partner is a big part of what we do. We can't do this without the incredible partners that work on the ground. It's been a real pleasure for me to go and meet some of our partners in various places across sub-Saharan Africa, and just see what a difference it makes if you put some very small resources in the hands of the people that really need it, the women and girls that are most affected, for all the reasons that Rukia very, very clearly articulated, the many vulnerabilities that they're facing.
Thank you so much, Cathy. I want to talk more about impact now, which we all know is so important. And we're fortunate to be joined by Yacine Djibo from Speak Up Africa, an amazing program that's having a transformative impact on the ground for women and girls in West and Central Africa. Yacine, tell us more about the work you're doing in this space.
Thank you very much for the invitation to join this very esteemed panel. As a woman-led organization, gender equality is at the heart of what we do at Speak Up Africa. And we believe that unless women and girls meaningfully engage in leadership positions and are part of decisions and are allocated the proper resources, that we will not be able to see the world we want to see in order to thrive. For us at Speak Up Africa, we're a women-led organization, and gender equality is really in our DNA. And we believe that unless women and girls in all of their diversity can meaningfully engage and hold leadership positions, make their own decisions, and be able to have the resources to be able to engage in their health programs and in health policies, we will not be able to see, what we want to see in terms of the world striving. So for us at Speak Up Africa, we are an African organization based in Senegal. And what we try and do is really work on advocacy, policy, and strategic communications to really be able to support African leaders, and specifically women and girls, in being able to take an active role and being able to identify the solutions that they need to be able to tackle the challenges they face. And one of those challenges that we all have seen is really women and girls in particular being excluded from decision-making spaces, being able to have a context that really is characterized by persistent social, economic, gender inequalities that they face and that contribute to them having the poor health outcomes that we heard, especially in reproductive health and HIV, maternal health. And one of the ways in which we at Speak Up Africa have been working to address this is very similar to the work that Viv and her Voice Fund are doing, is really through the Voix Essentielles initiative, which is also an initiative that we're implementing with support from the Global Fund and Fondation Chanel, to be able to ensure that communities, and more specifically women and girls, are able to meaningfully engage in these programs and policies that impact their health. And we've been implementing this program to date in Burkina Faso, Senegal, and Côte d'Ivoire, and looking to engage it, to expand it to other countries in Central Africa as well. And the idea here is to be able to bring together these organizations with their governments and other private sector companies to really be able to ensure that they participate in specifically Global Fund processes as well, to be able to ensure that their voices are heard.
Thank you so much, Yacine. Yeah, it feels like having women at the table would make such a difference. From your vantage point, what types of policies and initiatives should we be investing in to really empower the women and girls to ensure that they have a voice in these decisions, given these are decisions that are affecting their own health and well-being? Can you talk to any of those policies and initiatives that we are looking at or should be looking at and investing in?
Absolutely. I mean, I think as I just mentioned, I mean, the Voix Essentielles initiative is a perfect example, as is her Voice Fund. And these are the types of initiatives in my mind, and based on the feedback we've received from these community-based organizations and these leaders, that is needed for these for us to be able to enact the policies that we need. And Rukia certainly mentioned to some of the critical ones that are currently much needed in our environment. And so for us, you know, some of the examples we've clearly seen, for example, in Burkina Faso, and I'll give some examples, you know, is one young woman, Amanda Sawadogo, who was involved many years fighting for ensuring that the rights of vulnerable populations are taken into account. And with support from the Voix Essentielles initiative and a lot of other work, now she's a member of, you know, one of the Global Fund coordinating mechanisms at country level that determine the allocations of funding in country. And this was, you know, the first time that we had a community voice as Amanda sitting there and able to come to the table and clearly articulate what she needed and what, you know, her community needed. And what we're trying to do is really ensure that this continues to happen. And this is just one example, because it was what the work we did with the Global Fund. But another example, as part of our Voix Essentielles group, is Bénédicte from Burkina Faso as well, who now became a member of parliament. So now she's able to sit in parliament and be able to directly share her perspective and be able to have a role at parliament level. And finally, another example that for me reflects very much what is needed and why it's important to have these young women and girls in decision-making spaces is with Farida, who's a young woman who's 23, who started with a blog and today has an organization that, you know, spans across the country with more than 20 members to date and less than a year. And they work to promote the rights of women and girls in Burkina Faso and ensuring that they have access to the services that they need. So really, we should be investing in programs and initiatives that directly put funding and resources in the hands of the women and girls that need it, and these grassroots organizations to be able to support them, the organizations themselves, but also their leaders, by giving them also capacity in terms of leadership. That's also something we've heard loud and clear from the women and girls that we're working with, is that they also would like to benefit more from capacity, you know, in leadership, in governance, and really being able to allow them to be able to have that meaningful contribution when they participate in these decision-making spaces. So for me, it's really critical that we continue these types of initiatives that we've been discussing and that really directly support these community-based organizations and their leaders.
Thank you so much, Yacine, for sharing those specific examples. You talked about the Her Voice Fund ambassadors, and I want to turn to Millicent, who we're so fortunate to have with us here today, because she's a Her Voice Fund ambassador for Botswana, which is one of the 13 Her Voice Fund priority countries in sub-Saharan Africa. So Millicent, tell us about what motivated you to become a Her Voice ambassador and how the role in the Her Voice Fund has impacted your life and the lives of other adolescent girls and young women.
Thank you so much, Jennifer, and thank you so much for having me as well and having a youth voice in this panel, amazing panel. So I come from a country that is ravaged with HIV and AIDS, and it has, for me, has always been, if you're not infected, you're affected. And because of the community that we live in, we're a small population of 2 million, it was either next door or the yard next to you, or a friend or a family member that you may know that is affected or infected with HIV and AIDS. And it was, for me, the main question was, what can I do? And with the little that I have at a young age that I am at, I've seen different organizations do a lot of things. Different organizations come into communities and implement programs and projects, and then either leave where they leave with a gap because of issues of sustainability. And it has always been, but what can I do and how can I best contribute to ensuring that we're reducing the HIV incidences? And when Her Voice Fund program came about, the call for application came about, I applied, and fresh from school, it was something that, one, I didn't know what to do because I didn't have the resources and I didn't have the linkages to where I can actually contribute and to use my time and skills towards. And when I was accepted to be a Her Voice Fund ambassador, what I loved about it is that as much as I was availing myself and my network of young people that I come from, or the communities that I come from, what Her Voice did for me was build my capacity to say, as much as you have the potential to be a leader, you also need to have the know-how of being a leader. And there was so much capacity, which is what Her Voice Fund is main attribute towards adolescent girls and young women who want to take up these spaces is that they contribute to building them. Her Voice is meant to build leaders, and the investment that comes from Her Voice in building leaders is why today I can actually articulate myself quite well in this panel to share what our communities are going through. Is because there was resources, and thank goodness for Viv Healthcare and the World Fund through Y Plus network, is that there was so much capacity that was invested in us in building our capacity, building our knowledge, and building our skills before that we can actually take up leadership positions in health.
Well, thank you. And I have to say, I'm so grateful not only to have you here today, but working with us on this fight, because clearly you bring a passion. There's a reason why you are a Her Voice Fund ambassador. So I want to thank you for that. But I also want to pose the same question to you, Millicent, that I had posed earlier to Yacine, which is, from your perspective, what more should we be doing to empower adolescent girls and young women to ensure that they are having that voice? You're talking about having them involved in these decisions that are impacting their own health and well-being. Do you have any thoughts on, obviously a lot is being done, but any thoughts on what more we need to do in order to do this?
Jennifer, for us to have social behavioral change in communities, which is the reason why we see the increased number of HIV and AIDS, is because there hasn't been, I think, as much as we progress, we digress as well. Issues around information and education and linkages to services remains the key priority. And if we don't crack the code around informing and educating young people and linking them to services, we will never then win the fight against HIV and AIDS. I'm speaking towards information and education more because as much as we're pouring information to where young people are at, social media, news, television, what is more important is that SRHR or HIV is a lot of stigma. There's so much stigma around it. And if we don't program towards where young people feel free to access information and education, because even myself, for example, I will find something, then the first thing I do is go into Google and try and find a solution or understand what that issue is. Same applies to young people. I happen to work with in schools, university schools and secondary senior schools, where we meet young people and we ask them, where do you get your information? And they say the first people that they get the information from is their friends. Where does that friend get that information? That friend gets from. So it's a channel of misinformation and miseducation, in which then the young person makes a decision that is not well informed. So how can we then reach young people to where they are at? Governments and policies. I know in Southern Africa, we have the ESA commitment where we're trying to get access to schools and provide comprehensive sexuality education in schools. It needs to start in schools because at the end of the day, young people, specifically young people, spend majority of that time in schools. So we need to find ways in which, as much as we work in communities, but how do we have access to get into schools? Because if we don't teach these young people ways or their livelihood or comprehensive sexuality education in schools, then we have missed an opportunity, that age group where they're still malleable in order for you to teach them and guide them correctly. If we don't teach them from that age group, it's going to be difficult for us to then access them when they're already back into their communities or when they're already a part of out of school youth. So it's important that our policies now, we need to reverse our policies in ensuring that our organizations have access into schools. Information and education is broken down to the level of young people. I'm a radio presenter, and every time when we get to talk about issues around sexual reproductive health, sometimes where we thought we were programming for young people, we find that there's a lot of misinformation from the parents as well, that they don't know these issues. And because they don't know these issues, they don't know how to articulate these issues to their children. So there's also that mismatch of information where parents don't know what to say to these children, and the children don't also know where to get this information. So as we channel information, as we channel education, as we channel linkages to these services, what we need to do is come to the level of young people in understanding where that influence is coming from, for us to program better for them.
Yeah, that's great. You know, I was a few months ago, I was in Cape Town and we visited a high school where there was a number of young girls were brought together to have these conversations, and they were referencing that they would never have those conversations with their parents. But yet, when you when you create a setting that's moderated and they're able to get this type of information, it's really incredible what can happen in programs like that. So thank you so much for sharing that. I want to turn to Rukia and talk a little bit about the tangible solutions and what's working. So Rukia, beyond the Her Voice program that we just touched upon, what are some of the other ways that the Global Fund is improving global health for women and girls? And also, could you talk a little bit about when companies partner with RED and the support goes to the Global Fund, what types of programs are those grants supporting? I'd love to hear a little bit more from you on that.
Thank you so much, Jennifer. The Global Fund partnership has supported women and girls programs and initiatives in various ways. And beyond the different initiatives that have been discussed by Millicent, by Yacine, I'd just like to take a step back and refer us back to the Global Fund strategy. So within our Global Fund strategy, we have reaffirmed our commitment towards addressing health inequities, gender inequalities, and addressing human rights barriers. I must also highlight that we've put communities at the center of everything we are doing, and of course are collaborating with various partners across countries in addressing these issues affected by women and girls, including engaging the communities in these decision-making spaces. So when it comes to programs and initiatives that target women and girls, first of all, we are guided by national policies as well as national plans, and are also informed by the technical guidance that is actually developed by our various technical partners. We also collaborate with communities and civil society organizations who understand these issues on the ground. As Millicent alluded to, they live these lives, and using their lived experiences and knowledge, they know what is working, what is not working, and then bringing this conversation back to the program design and the policy design. And both Millicent and Yacine spoke about Voix Essentielles and her Voice Fund, and how we are engaging women and girls across various programs. And the Global Fund investments towards women and girls programs, of course, complement other investments by various partners who are working in this area, partners such as PEPFAR, partners such as VIV, domestic funders, governments, and all other partners working in this area. And this is about working through partnerships. And as an organization and through the partnership, we are investing in biomedical interventions. We are investing in behavior change and structural interventions. And this is because the issues and the risk factors for women and girls have multiple layers and are interconnected. It also means that as one funder, we are not able to address all these issues within one grant. It also means complementing with other funders. It also means bringing on board other initiatives that may not necessarily be within the Global Fund grant, but work comprehensively across the partnerships within the country and within the leadership of the countries. And we look at these programs either by investing in behavior change interventions, and Millicent spoke about this, talking about comprehensive sexual health education, whether in school and out of school, within the context of the countries and within the policies of these countries. And of course, these investments complement other investments we are making, such as programs towards antenatal care, child health programs, programs of PMCT, programs on differentiated testing, treatment, condom promotion and distribution and increasing access, and other programs including voluntary male circumcision, among others. And just to conclude that the Global Fund contributions within countries is also embedded within the framework of strengthening health systems and making them resilient, which is, again, another area that certainly supports and provides an enabling environment to support programs for women and girls. Back to you, Jen.
Thank you so much, and really appreciate that understanding and such a comprehensive response that the Global Fund is doing and having. Speaking of the Global Fund, Cathy, I understand that the Global Fund, VIV Healthcare, and GSK recently announced an exciting new initiative and a fund focused on girls, women, and gender diverse communities at Women Deliver in Kigali. Could you let us know a little bit more about that and what makes this particular partnership so special and unique?
Yeah, no, happy to. So, very exciting news as we went to Women Deliver and we announced the Gender Equality Fund. And we know that gender equality, community engagement, and health are so powerfully linked together. You know, we've talked about the inequalities, the discrimination, and the challenges faced by women and girls. And this fund really is designed to address some of those by looking more holistically, not just at a specific area like HIV, but looking more holistically at the challenges faced by women and girls. So it's that interface between gender equity, community, and health. And we know that if we don't tie these things together, we're not going to solve this. We're not going to impact this epidemic. In fact, keeping women and girls out of the mix, keeping community out of the mix, you're just going to drive the epidemic. So we need to do something differently. So we came together with GSK and we talked with the Global Fund, and we put together a new fund, $7.5 million in the fund, and then actually we also attracted further funding for the Global Fund through Gates. So it's a really good fund that has been developed. It can be added to. We're very open to more people joining. But when we announced the fund in Kigali, the response from the community representatives there, the young women there, the Her Voice ambassadors, the Voix Essentielles ambassadors, they were really fired up and excited, as well as lots of other organizations. But what the fund is intended to do is to really let the decision-making come from communities, from from young women to tell us what it is that they want to do in their communities that will make the biggest impact on their lives, on the structural barriers that they see, on the social challenges that they have. How will they use the fund to try and drive that change? We know that the only way that we are going to really see a sustainable change is if those women and girls are the people that are driving this change and driving that. So the fund is there. It will be really exciting to see what the community-led organisations, what the women-led organisations come to us with and want to do in their own communities. And we're expecting, as I say, we're really, for ViiV, this is new because we've got a new partner in GSK come to the table. We've got obviously the match funding from Gates, which is fabulous. And we've got the guys at the Global Fund who, as we've heard, know all too well what needs to happen in these countries. So the fund will be really there to be utilised by the very people that we need to get resources to. And I think one of the things that I have been really encouraged by in terms of her voice is exactly the thing that Millicent was talking about there, where you can really get into very small women-led organisations and get the resources in their hands. They know what they need and they know what's best to do. And that's what this fund is designed to do. And we're really excited about it. We want to put the girl at the centre of the fund so that it's not just one aspect of her life that we're trying to help with. It might be economic empowerment, so important in terms of dealing with some of those power imbalances. It might be better sexual reproductive health rights. Again, you've heard from the other panelists, really, really important to work on that with young women, with girls and young women. So we're really excited about it, but it is that intersection of health and gender equality where we're trying to drive some sustainable change in community-led, women-led spaces.
Absolutely, and an incredible commitment that you all have made. And I couldn't agree with you more. There's so many companies out there that are focused on women and girls. Let's get them and bring them into it as well and generate more funding. So I wanna bring us to a close here. We've spoken a lot today about some of the challenges facing the global AIDS fight, obviously very specific around young women and girls. But I'd love to end on a positive note. So I'd love to ask each of you, what is one trend or innovation that you're seeing in global health that's making you optimistic that women and girls will have a brighter future? I'm going to go top to bottom on my screen at least, and I'm going to start with Yacine. You can have the first answer.
Thank you very much, Jen. And certainly for me as a civil society and working with local communities, we are really witnessing a positive shift in the outlook and perception that we see from the private sector, but also the donor community, and see ourselves increasingly as partners and resources to be able to work together, to be able to share knowledge, to be able to co-create and unlock, more innovation, build stronger health systems, and really be able to ultimately deliver health for all. So for me, this type of innovative, impactful public-private partnerships that we're seeing really do make private sector investments go further, because it provides, not only the financial support, but also the technical support that we see from the private sector to be able to stimulate the impact on health policies and programs, and ultimately be able to have more of that meaningful engagement and inclusion of women and girls. And a lot of what I've heard today around really putting women and girls at the center of the response is really, for me, very positive, and seeing this type of commitment, from partners really does give me a lot of hope in what we'll be able to do in terms of being able to have a positive impact.
Oh, thank you so much. Over to you, Rukia.
This is a fantastic way to conclude the discussions, Jennifer, because it just gives us hope, right? And that keeps us going. For me, I'm very optimistic when I see more global solidarity across the board, despite all the challenges and everything else going on everywhere. I'm seeing a strong sense of partnerships in various forms. There's more willingness, there's more efforts to come together and reduce the fragmentation. And there's more investments aimed at opening the spaces that create more room to include everyone, and especially communities, especially those who are marginalized, those who are most impacted, including the women and girls in all their diversity, to actually sit in these decision-making spaces and the decision-making table, whichever table it is and wherever it is, wherever it may be located. So I am excited when I see people like Millicent and others across the globe just really claiming these spaces. But I know there's a lot that we need to do, and we must keep fighting for these spaces. So I'm very optimistic, but cautiously.
Thank you so much, Rukia. Millicent, over to you.
It is great to see prioritization of health financing towards adolescent girls and young women, and especially investment, like Cathy had mentioned earlier. We're now seeing organizations and global donors coming together to fund and prioritize the health of adolescent girls and young women. So for that, give me rest as a health finance advocate, that we're seeing resources being put towards the health of adolescent girls and young women, and towards the development and capacity building of adolescents in order for them to actually be leaders in the health space and take off the baton from those who've gone before us, to ensure that at the end of the day, we prioritize the well-being of adolescent girls and young women.
Thank you so much. And Cathy, you're the one who brought us all together today, so you get the last note. Give us some optimism.
Yeah, I'm very happy to. I think what makes me really hopeful about the future is really the young women that we meet when we go out to see the programs and we meet the partners, and you meet some young women who are really they're playing their part, they're really contributing, and they have such energy and passion. And I think that always makes me come away feeling hopeful for the future, because they really want to take ownership of their own future, and they want to give to their peers. So whether they're a peer educator, whether they're a mentor, mother, whatever role they're playing, I always come away from those meetings feeling like there is a better future for women and girls around the world. Yeah.
Thank you so much. So in closing, while we've made extraordinary progress, it's clear that our work in the AIDS fight is far from over. And only by investing in marginalized communities can we truly fight the injustice that enables pandemics like HIV to thrive. RED's committed to this work by partnering with the world's most iconic brands and people to help empower health workers and provide testing, treatment, and care in places where they are needed most. Speaking of incredible partners, I want to thank ViV Healthcare for sponsoring today's episode of Red Talks, to Cathy Ferrier, Rukia Männikkö, Yacine Djibo, and Millicent Sethaile. Thank you so much for joining me here today. Stay tuned to this channel for the next episode of Red Talks, and be sure to follow Red on social media to learn more about how you can support the fight against AIDS. Thank you so much for joining us, and have a great day.